Hi guys, good morning. This is Dr. Jenny Yusuf, physical therapist and doctor of physical therapy, creator and founder of Balance and Fall Support Group in Aging Adults, and Physiogen PT and Wellness. So every Thursday, we highlight innovators, academicians, physical therapists. So if you are in US, good morning. And if you are in Asia or Philippines, good evening. So wherever you are, have a good day, guys. Okay. So once again, it's Dr. Jenny, and we have amazing physical therapist for our guest today. All right. She is a physical therapist, doctor of physical therapy, and a pelvic floor specialist. And also she is a pelvic rehab practitioner, certified functional nutrition counselor, and of course, specialized in dry needling. So without further ado, I have Dr. Netherine Agsalda, and she is my colleague back in Abu Dhabi. You remember that I work in United Arab Emirates, so it's just amazing. We are 22 years now as physical therapists, and Dr. Netherine has her own practice and a full-time in her outpatient clinic as well back in Illinois. So welcome, Dr. Netherine. How are you?
Oh, good morning, Jen. Thanks for the invitation. It's my
Of
pleasure to be here.
Of course, of course. Congratulations in your practice, Dr. Net. And also, I know that you have a clinic now, and I know you're really doing well there. So tell us more about your experience and your practice in Illinois. Correct? It's in Illinois, right?
So I came to Illinois way back in 2010.
Mm-hmm.
So my first practice is mostly from nursing home. Then I find my way back to outpatient rehab like 9 years back. And it was not my plan to go for a pelvic floor to become a pelvic floor therapist. Then suddenly I had this one patient one day, and those days maybe pelvic floor therapies are just beginning. So the script that I was given was for a pelvic floor or for a back pain, and I keep asking the patients questions about what caused their back pain, uh, how much is the pain in the back, like activities that gives her back pain, and the patient is like telling me, I don't have back pain. Like I don't know who gave you the script that I have a back pain, because maybe those days, even doctors, the referring doctors, are not so much aware about pelvic floor issues. So if you remember back in the days, we don't address that part. Like we went to school and we treat neck pain, migraines, shoulder pain, scapular pain. But every time we reach the pelvic area, we go straight to the hip, because nobody really go there and address those muscles that support your pelvic viscera, like, or your where you the muscles that are involved in very intimate sexual relationships. So this patient like looked me in the eye, and she's starting to get irritated and told me that I don't have issue in my back. And so I was like, so what's the problem? And the problem is about sexual act. Like she cannot get herself involved in sexual intimacy because of too much pain, and she is married.
Okay.
So I don't know how to treat that. So I went to my supervisor and I was like, look, I got a script here for back pain, but this patient is telling me that the issue is not in the back at all. And so I don't know how to treat her. And so we scoured the internet, and we find this pelvic floor therapist, which is just starting like 45 minutes away from us. And then after that encounter, my supervisor asked me, are you interested to go on a pelvic floor therapy training? And I was like a little skeptical at that time. And I was like, But at the same time, I was like looking around, and like everybody have their own specialty. Like somebody wants to do neuro, stuff like that. And I was like, why not? I should try. And then I started my training with pelvic floor and walleys. And I think that made a big impact and a big difference on my career, because like I can treat everybody from head to foot, like knowing Like if we think right now, like even when we are college, just the basic physical therapy thing, we always tell that the center of gravity is in S2, the pelvis is the center of your posture. If you correct somebody's posture, always start with the pelvis. Those are things that we just read on books. And
Mhm.
then when I went for training, I was like, wow, it's amazing because pelvis should be the beginning of everything. Like, and without correcting the pelvis, you cannot correct back pain. You can find a person with a pelvic floor issue that is stemming from the pelvis, but the patient is having migraine, or the patient keeps injuring the foot or the knee or the hip, and it's because there could be issues in the pelvis. So, and then it's complicated, and I just love the complexity of it.
Wonderful. Oh my goodness. So we're really thinking now how important as a physical therapist that we're able to really direct to the point that not all patients when they have I always remember the anatomy train. They will come to you that they are in pain of low back, but you will later on find out that it's on their foot, you know. So right now the pelvic as a pelvic floor therapist and specialized therapist, you really can pinpoint right away what's the root of the problem of our patient. Looks like you have an x-ray. And then ECG.
They said the body is connected from head to foot and from foot to head. And like, well, we always hear it like a cliche back in the days, but now I was like, yes, it is. Like, the complexity of pelvic floor doesn't just ends up from the part of the body itself.
Mhm.
So as you tell, I have like a certification in dry needling because pelvic floor is also being affected by the fascia. So fascia is the glue that connects our body from head to foot. And when that fascia is also restricted, part
Mhm.
of your body is also not moving well. So if you are a pelvic floor therapy, you are not only looking on the joints, you are not only looking on the muscles, you are not only looking, you need to look on the fascial connection as well, because any restrictions in there can affect the body as a whole. So, and I love that complexity. And also, it's not only by the structures of the body, the mental thought and the mental upbringing of the person, uh, past background, history of abuse, how they deal with their daily life, stress, their coping mechanisms, how
Mhm.
they sleep, their sleep pattern, the way that they eat. All of those are affects pelvic floor. And because it's so complicated that it's like putting the puzzle, like it's so amazing when you get what is the impairments of the patient, and then like what I say when Herman and Wallace interview me, like it's always a music to my ear once the patient comes here and tell me that, hey, I've been using like 1 pack of Depend per day before I came to you. And now I'm like using one per day, or I'm not using anything at all. And it's like, it's I'm so thankful for my pocket because now I can use my retirement money to go somewhere else or to do what I want to do and not buying these things. Because before, some people cannot even go out because they are dripping. They just cannot control it. Or worse, if they are having fecal incontinence, because you cannot hide that, it will smell.
Oh my God.
Yeah,
Yeah.
so it's so nice to change somebody's life when you get to the point that they're better. And it's always like when I follow one patient's life, like you will learn to know them, how they think, how they eat, how they rest. And I think that makes it more you they get attached to you in the way that they will turn to you when they want some advice, and you get closer to them. You have this like accountability about their life, and I like that feeling sometimes. Or
Wow,
most.
that's amazing. Because I'm about to ask you your wins and challenges, and you just shared one of your wins, improving the incontinence of one of your patients. So how about Dr. Net? Things like what your day to day, like some I'm seeing a skeleton right now for all our viewers who's listening, either they are students or clinicians. So what are the tools that you as a pelvic floor specialist, therapist, of course, use in your day-to-day clinic? So it, of course, it's case to your, it
So
depends
when
on
I,
the case.
yeah, when I handle patient and when I hear their story, like, of course, like when I do in service with my colleagues, I'm trying to realize, like some of them cannot even like grasp the complexity of the pelvic floor topic. And so when I'm handling patient, like I always think like I wanted to explain it to them like in all aspect that I can explain, because I always tell them like if there's one thing I can help you with, like it's not because you feel better at the end of this treatment. I want you to feel that after I will let you go, you are empowered. Like you need, I want you to realize and why it happens. Like you should understand why it happens and what are the things that you need to always check so that it won't happen again. And so I am like very I would say like I I'm a broken record. I tell them over and over and over again how to look on their posture, how to coordinate their movement, what are the things that they need to watch out in their daily life. Because I tell them this is the loophole of your body, this is the weakness of your body, and it can always come back anytime. Anytime there's a sudden change in your life, anytime there's a difficulty, it can come and haunt you. So you need to know how to get better from them without relying on me. So when I treat patient, I explain it one by one. Like I have here, like I have a skeleton here. I show them where the pelvis is, where are the nerves. I show them the curve of the skeleton. I show them the alignment of the body. Then I have like things like this, like you show them where's the rectum, where's your for female, where's the uterus, the ovary, the bladder, and then for male, I have also like same like male counterparts. So
Uh-huh.
I have these images, and then I show them like where are the sphincters are, because if your pelvic floor are connected to your tailbone and to your pubic bone, then I show them what are the sphincters that allow them to defecate, to urinate, to have a sexual intimacy, stuff like that. And then I also love working with a mirror. So mirror shows a lot. So most of these patients, their proprioception has been like not working properly for years. Like when the worst scenario is like when you ask them, okay, I want you to lie down in the bed, square yourself, level your pelvis, level your rib cage, level your shoulder, try to get your back flat on the bed. And then they will go and try to their best to, align themselves in the bed, and you will see that they're totally oblique. And I was like, do you feel straight right now? And they would say, yes. And so I will pull them and align them. And they're like, that's not straight. That's how bad it is. So just imagine a patient not feeling their body when the bed is, supporting them. Then they get worse when they are standing. And so I love to work with mirrors. I have like mirror in front of the patient and mirror on the side of the patient. And I'm like showing them what are the things that they need to align and how should they breathe, how should they coordinate the breathing with the pelvic floor stabilization.
Wow, that's really good because it's really pure education. At the same time, there will be a compliance of some of the exercise now that they understand. Oh, that's how it happens. And then
Yeah.
they are going to do their routine home exercise program at home. And of course, they have the understanding now that this is happening to them when they're peeing, when they're having bowel movement, and what
And
to
then also you don't need to make exercises so complex. So
do.
yeah, so just try to make it like as simple as you can give them, and that's better for them, because most of the time when the exercises is so complex, then they won't comply. And also like you need to match the exercise with the activity level of the patient. So if the patient is like, for example, just at home and not really an active, like somebody who is like running a marathon, then give exercises that matches their activity level. And then if you have an athlete patient, for example, because this pelvic floor population is not only for patients who are old. So with how active students are at school, jumping and running and very competitive in sports, I'm seeing higher numbers of younger individuals themselves who are like having urinary incontinence and issues down there. And also like plus the fact that we are so reliant with medications nowadays, like people who have like even just cramping and they are like given pills, those mess up the hormonal aspect that like, our pelvic floor area is very much reliant on hormone, estrogen, progesterone, testosterone, stuff like that. And when that balance is also being disturbed, then it can also cause issues down there. It's really interesting topic.
Good that you talk about something like estrogen, progesterone, and I'm sure also the diet really makes a big difference. I see here, Dr. Net, that you're also a functional nutrition counselor, certified functional. So we talk about before having the interview about the olive oil and things that you need to use, what not to use. What are your tips for our listeners right now about what will be the best food that they need to have in the kitchen and why it's beneficial, especially with some pelvic floor issues?
I was like 4 or 5 years on my practice as a pelvic floor therapist when I realized like there are cases that you just cannot make better, especially when it comes to bowel and urination, because urination is one of the and defecation is our one way of excretion. So and when we say excretion, we are literally like flushing all the toxins in our body. And so there are times that I have patients that are really very resistive, like people who doesn't poop like in 7 days. And you can do bowel massage every day. You can teach them how to drink one half of their body weight, and they feel like they are already drowning in water. And tell them drink, eat fibers this amount, 25 grams or something in a day, and they still cannot poop. And you're dilating their pelvic floor, and what's happening? And so I was like, and that that doctors won't tell you what is specific things to eat. Like they can give you medications like over-the-counter Colace, like bowel softener and stuff like that. But some patients are still not getting better. So I was like, I need to know more. And so I find out like about a functional nutrition program that I can do at home and on my own pace. So I enrolled with the certification, and it took me like 1 year to finish the certification program. And I was so amazed. Like I feel like exercise is only a tip of the iceberg. So yeah. So yes, exercise is very important, but it's also the food that we eat is very important. So when we talk about the pelvic floor issue, hormonal balance is very important thing. And when we say hormone, like people usually go away from fats because they think fats and cholesterol is bad for the body. On the contrary, cholesterol and fats is the precursor of our hormone. Only you have to know what are the proper fats that you need to put in there. So of course, processed food is a no-no for people who have pelvic floor issue. And maybe I could say it for everybody because a processed food delay the transit time in our gut. So instead of 2 to 4 hours in the stomach, 72 hours in the small intestine, if you eat processed foods, they stay longer. And the longer that the food stays in your belly, the more it get acidic, and that can cause cancers and other complications. And then uh, uh, drinks that are, of course, like with carbonation, sweeteners, they can make you pee more. So instead of that water to be retained to soften the bowel, then you are expelling it for urination, or and then that cause your bowel to be more hard. And then other stuff is like when you eat, there should be like always, well, I already told you that fat is the precursor of hormones, but you need trans fat is of course a no, but other fats like omega-3. Omega-6 is also good, but it should be balanced with omega-3, or else you will promote inflammation. And then when when we look on like cooking oils, canola oil is bad. So yeah, and oils that come from seeds, they are rich in omega-6. So I would say the best cooking oil would be like avocado oil, and then coconut oil or organic ghee and processed ghee, stuff like those. Like those can help. And of course, if you eat, you always need your fibers and your protein, because protein is the basic building blocks of our muscles and stuff.
Wow.
Yeah,
Thank
so
you. That's really a lot. Just like listening is all over. It's all related.
yes, and
Functional,
also
food.
functional
Mhm.
is very, like you also need to look onto their sleep patterns. So
Oh,
sleep should
yes.
never be negotiable. So I always ask my patient if they are like having issues with constipation. So are you sleeping good? So I promote 7 to 9 hours of sleep. So people who have like difficulty sleeping, then I ask them to coordinate with their doctors, or I can uh, tell them to get like some sleeping aids, because they need that sleep. So when we sleep, that's the time that your parasympathetic nervous system is active. So your body is in what we call rest and digest. So if you are in a state of fight and flight, which is the opposite of parasympathetic, your vagus nerve cannot do its function on your gut, which is to digest and absorb nutrients, because you are on the fight and flight mode. So we always need to promote relaxation, yoga, breathing, deep breathing techniques, meditation, vagus nerve stimulation, sleeping, nap, those kind of things. And night people who works at night, I find like, so now I kind of see the connection. So I see a lot of people have like issues of pelvic floor dysfunction, including constipation, because they are not sleeping at night, they are at work. And then when they go home, the light is there, they don't have a blackout room to sleep. So vagus nerve cannot activate their parasympathetic nervous system, because they don't sleep that 7 to 9 hours. And it gives them a lot of issue. Aside from not sleeping and not moving your gut properly, when you are in a state of sympathetic flight, you also have like the tendency that your cortisol level can go up. So cortisol is a hormone that responds when we are stressed or when we are not resting. And when the cortisol is up, it can give you a lot of other factors, because the precursor of your sex hormones come from the same gland, which is DHEA from your adrenal gland. So it can overuse your adrenal gland, it can overcause production of cortisol, and so it affects sex hormones. So it's just like basically a whole picture of it. And
Yeah. I'm just listening here, and then you can really explain that this one person you can track. Okay, during history taking, you just first ask what's your job and what's your issue, and then you will go into track. Okay, so you work this way, and then you just educate. Just some modification from that will
yeah,
definitely help right away. Change of modifying their food diets or habits,
you will be
modifying their
surprised.
lifestyle. And
Yeah,
then
you
you
will
will be next to the picture. Mhm.
Yeah,
Go ahead.
you will be surprised how many people doesn't know how much they should drink water per se. And you will be surprised that people doesn't know that eating processed food is bad for their body. Like lots. And you just change that aspect, and then maybe 50% of your problem is gone. Like they will come to you and nobody taught me about this before, but I feel much better. Like I was like the achiness of the body, like part of that is going away as they learn how to modify their thinking, their lifestyle, the food that they eat. So that this is one of the reason why I love pelvic floor a lot. Like it's not only just the muscle or the bones or the nerves, it's the whole person.
Yeah.
So
It's a
yeah,
holistic approach. That's what exactly what you're doing.
and I
Yeah.
love doing it. So when I see patients that are just like acute back pain or neck pain, it became easier to treat because most of the 80% of the time, my cases are the complex one. The people that usually come to me are patients that have been to 7 doctors, more than 7 doctors, more than 7 practitioners. And they are like, oh, the doctor refer me again to therapy. Like, I've been having this for like years and nobody can make me feel better. Like, they already lost their faith on feeling better. And sometimes I was just, can you give me your last trust? Like, let's just try this for the last time. And those are the very challenging patient that I wanted to meet. Like they gives me like purpose in life.
Nice, nice.
Yeah.
From there, Dr. Nedrin, congratulations. We learned a lot from you. It's more on learning about what is the essence of the pelvic floor therapist, and then with your other credentials and certifications that you use for the dried needling and functional nutrition, it really overlapped to treat them holistically. So you already gave us some tips and everything with all those tips for the foods and exercise. So how can we connect with you? So if we have clinicians who wants to learn more about pelvic floor therapy or some clients that want to learn more from you, so how can we reach you, Dr. Net?
I have my Facebook, like Netherine's Physical Therapy, Pelvic Floor and Wellness. And I also have my own website. So they can email me there or they can send me message via Facebook. I would love to help. Like they can message me via my phone. It's they can see it on my website also. So
Yeah. Thank you so much, Dr. Net. And then any closing remarks for our listeners for the balance and falls and Fissiogen?
yeah, so pelvic floor affects a lot of people who are falling because in this population, people go to the bathroom, even the worst, every 15 minutes. And in our older population, when this attacks them at night and they keep on draining their water, then they have like lots of fluids and they go into dehydration and then falls happen. So I've seen a lot of issues like this, but I've treated patients from younger generation to the older generation. And I was once mistaken that if you are old already, like it's so hard to treat. But the oldest patient that I've gone so far and had a wonderful story of success is 94 years old. She's a resident of an assisted living facility and came to me on a wheelchair. And I was like, she cannot even stand. She's like max assist to like transfer from the wheelchair. And I was like thinking, what will I do? Like, but she has a sound mind. So I treated her like same like any other patient that I treat. And to my surprise, the body can adapt. The body can learn, the body can heal if given with the right stimulus, right exercises, right intervention. So as of now, she's still in assisted living facility. She did not went to a nursing home and she's enjoying her life there. So probably now she's already 98.
Wow. Thank you
Yes.
so much for
Yeah.
sharing that. Yeah, that's good. You nailed it because we have the balance and fall support group. I'm sure they will be feel the connection there, that they're always running to the bathroom. And I agree, we have lots of falls recently, and then we have it ended up to have hip fracture and everything. But if we find out the root of this, which is urinary incontinence, or maybe it can be better, that will be a great help. So that's really amazing to learn from you, Dr. Net. Thank you so much. So guys, if you have any more questions, connect with Dr. Net. We will going to put her informations here and then her email, and she will be one of our speakers for the upcoming Geriatric Rehab Summit 2024 this coming August. Thank you so much, Dr. Net. Thank you so much,
And
guys.
have a good day. Bye.
Yes. If you have any questions, connect with us and Dr. Ness email, and she is available in Jacksonville if you want to see her in person. I don't know where are you guys, but definitely it's worth connect. And thank you so much and have a good day. God bless you guys. Bye for now.